Hello and welcome to this series of videos related to curriculum development in health profession education. The main aim of this series is to support students at postgraduate level in health profession education at master and PhD level with the concept related to curriculum development, implementation, and assessment, and also to support those who are working in curriculum committees and curriculum development. Today's video will be about curriculum analysis in health profession education. The learning outcome of the session will be, we will define the curriculum analysis, identify the dimensions of the curriculum analysis with focusing on Posner framework, apply having some sort of application of the knowledge, and also explore the other potential framework that we can use, such as hardened 10 questions framework. And we want also to share some example of the published articles related to curriculum analysis. So let us start with the definition. What do you mean by the curriculum analysis? Curriculum analysis is a systemic study of the curriculum, intent, content, and implementation, and outcomes to reveal alignments, gaps, and any implicit message in the curriculum. So it is a systemic study of the curriculum and considering the different type of the curriculum. And in order to know about the different type of the curriculum, we encourage you to see the previous videos in this series. So the curriculum analysis should answer what is taught and why, who decide this, and how does it influence the learners, educators, and the society. And this is a very important measure that we need to take, and very important process, because in the concept of social accountability and competency-based medical education, considering the social obligation toward the community, the curriculum analysis is very important to analyze to what extent the curriculum is meeting the societal needs, and to detect the hidden curriculum on any intended bias. And I also encourage you to watch the video related to the hidden curriculum in this series. And curriculum analysis helps to guide curriculum reform and support the accreditation process, support leadership decisions and policy change, and strengthening the educational quality and the patient outcome. Now let's see the scope of the curriculum analysis. The curriculum analysis, including the curriculum document and all blueprints of the curriculum and all manuals, objective and assessment plans, including the competencies, any stakeholder perspective, any previous data, previous reports, patient, faculty, students, any previous analysis of or report of the studying or measuring the learning environments, and finally the institutional context and the philosophy. I highly encourage you to read this book by Posner, which is, and the rest of the slides here will take the concepts from this book in analyzing the curriculum. So what are the important dimensions Posner identified to analyze the curriculum? The first one is curriculum documentation and origins. Who decided and why decided? What is the philosophy of this curriculum? The second one is the theoretical perspective, the educational philosophy or paradigm of this curriculum, the intended learning outcomes or the competencies, and the outcomes here for knowledge, skills, attitude, the content and sequence principles, how the topics are arranged in the curriculum, the courses are arranged, and so on. The curriculum in use, what is practiced in the classroom, in the hospitals, in the clinical trainings, the simulations, the labs, and so on. We need to identify also the hidden curriculums. And as we explained in the previous videos, the hidden curriculum by qualitative analysis, we can identify the hidden curriculum and know very well what are the messages in the hidden curriculums. And also for the evaluation and reform through this dimension, including the feedback and continuous analysis. So curriculum documentation, theoretical perspective, intended learning outcomes, content and sequence principles, curriculum in use, hidden curriculum, evaluation, and reform. And these very important analytical questions that need to be asked when and while analyzing the curriculum. Who developed the curriculum and whose influence directions for what needs the curriculum is developed, what societal and educational problems was it addressing, or why the curriculum developed to address which problems in the community. Is it communicable disease, non-communicable disease, or which problem? What theoretical perspective influence the design? What the educational learning theories influence the design? What content sequence? Is it modular? Is it integrated, spiral integrated? Is it blockwise? Which planning elements were emphasized or neglected in this curriculum, and what potential blind spot exists? So these very important questions that need to be asked while analyzing the curriculum. And I will share with you example of these questions. For example, when examining the theoretical perspective in Posner framework, the first question here: what aspect of culture or of our cultural or scientific heritage should be preserved? We have basic science, for example, we have clinical science, what we should preserve. Transmission of established knowledge and professional values, for example, this is the focus of the curriculum. We have basic science, biomedical science, which should be preserved, which values need to be considered in this transition between both the basic clinical science and so on. For example, heavy reliance on lecture, textbook, and standardized content. This could be a blind spot related to this curriculum is limited flexibility, or there is a passive learning approach here. When we look at experiential perspective while analyzing the curriculum could be, the question could be, what experiences foster individual growth and learning? Because the philosophy rooted in experiential learning through doing and reflections. An example of that, for example, if the curriculum is using problem-based learning or community-based learning, so what are the experience that is fosters and based on this experiential learning theories? And the blind spot here can lack structure consistency, not scaffolded philosophy, because using some learning approach, such as problem-based learning, there might be some issues with the well-structured framework of knowledge. So here we need to examine very well the experiential perspective in the curriculum. Also looking at the structure of discipline perspective, the question here, what is the underlying structure and process of the scientific inquiry? And the philosophy here, learning should reflect how experts construct knowledge. For example, in medical education or in health professional education, integration of philosophy, physiology, pathology, and pharmacology around clinical problems, this might help the student to think like scientists in integrated cases. But we have blind spot here. Students may ignore learning about the emotional and contextual aspects of practice, and this also need to be examined here. When looking at the behavioral perspective, the question could be, what should learner be able to do at the end of the curriculum? This is a learning outcome, and the philosophy, we should have a measurable and observable learning outcome. And nowadays, most of the curricula, they are using competency-based medical education and even entrustable professional activities. And focusing on this issue might create a blind spot and risk of focusing on performance over reasonings or processing of this information and competencies. This is very important. Also, there is a cognitive perspective here, and the question that need to be asked while analyzing any curriculum: how can learner make sense of knowledge and think more effectively? And the philosophy behind this: knowledge is actively constructed and reflection deepen understanding. And we are using now reflection and portfolio-based learning, and we are encouraging using the metacognitive process. But there is also blind spot because these things are difficult to measure and require skill facilitations for us as educators. So looking at this perspective, the curriculum analysis is not something like ticking the box. No, we should take all this perspective into the account. Another commonly used framework for analyzing any curriculum is hardened 10 questions. And you can take a screenshot for the screen and uh, to see these 10 questions. I started with what are the needs in relation to the product, what are the aim and objective, the content, organization of the content, educational strategy, teaching method, assessment methods, how the curriculum is communicated, environment, and how the curriculum and how should the process be managed. So these are the 10 questions, and many articles has been published using these 10 questions raised by Hardin to be asked why well develop or analyze a curriculum. The article in the left side of the screen for undergraduate curriculum and the article in the right side of the screen for postgraduate curriculum, and you can read this article to see how the authors use this Hardin framework. So thank you so much for this introductory session about curriculum analysis. I highly encourage you to broaden the scope of the knowledge shared in this session about the curriculum analysis and to see the dimension of the component of the curriculum that should be considered while analyzing the curriculum. Thank you so much, and see you in the next session, which will be about curriculum mapping.